you're going to set up your table. And when you set up your table, you try to do as few steps as possible. So when you first start learning to set up your table, of course, you're going to be moving things around a little bit more. But after you become proficient at it, you should be able to set up your table with as few steps as possible. So what you're going to do is you're going to start at the left and work to the right. If you start at the left, that means that you're going to get your basin set, and you're going to put your basins onto your table. So you're going to have your suction tubing and needle counter. 2 disposable suctions, the Yankauer and the Fraser. You're going to get your sponges out, put them along here. You're going to get your basin with some of your medicine cups and your marking pen and some sutures and a blade. The light handles for the light. The Bovie tip and case. Dissectors. Now your basin is empty, and then you're going to get your drapes ready. You're going to put them over here. Most of the time you'll have at least 4 towels to drape the patient, so you're going to fold your towels. All you have to do is pick up the tab, open them up, and fold them. And here's towel number 4. So your drapes are all set to go. Once you have that, you have some sponges and some hanks. These are all countable items. You have your suction and your needle counter. You have 2 because 1 came in your basin set. Now you're going to aseptically pick up your kit pan and put it on your table. So the kit pan goes this way, so that your retractors are over here and your stringer is here. This is a suture bag. In some institutions they don't let you use a suture bag, but in most institutions they do. So you can either hang it off your mayo or the side of the table. And this is to put your trash in. You never reach into it once you've put something into the bag. So now you're going to roll your towels. You have 2 stringers, so you need 2 rolled towels. You take the towel, you get the edge that opens up, you fold the 2 corners in, and you roll. Now the second towel, you do the same thing. The smooth edge is away from you. The loose edge is towards you. Fold it in on the 2 sides and roll. The smooth edge is away from you because that's where the instruments will sit and they won't get caught on the open edges. Now you're going to grab your stringer, going to lift it up. You're going to put it onto one of the rolled towels. You're going to grab your second stringer, which is a shorter stringer, and you're going to put it on the other rolled towel. Now you're going to straighten out the pan itself and set your forceps, smooth forceps on one side, tooth forceps on the other. Get your retractors in order, get your scalpel handles out, and anything else you're going to use on the field. So we're going to start with the forceps, and we're going to put the smooth on this side, the long smooth, the DeBakey's. The toothed on this side, long tooth, Bonnie or Ferris Smith. Most forceps come in pairs. Adson, short toothed, Neuro with teeth. Now we have this set up so we want our retractors. We have our malleables on the side. You put your retractors in order of size, large right angle, medium right angles. The Richardson Ladyfinger Appendicele retractor. McBurney, all lined up in order. Then you have the Army Navies, which will go next, the pole retractors, the vane retractors, or whatever retractors are in your set, and you put them alongside of the other retractors. Then you have your scalpel handles. They'll go over here. Brakes, sends, sponge forceps go over here. Wheat lanners, suction, suction, probe and groove, suction, and you're ready to count.